Hi, you're listening to the Psychopharmacology Institute podcast. I'm your host, Dr. Agdan Rashad, and this is the show that aims to help you, the mental health clinician, stay sharp on psychopharm. If a mother is exposed to stress during pregnancy, does this put her offspring at risk of a personality disorder down the road? Why is this question being asked in the first place? Well, there has been research that has found a connection between prenatal stress and the development of psychotic, anxiety, and depressive disorders in the offspring. So why not personality disorders? Dr. Jim Phelps is going to take it away in this episode, reviewing this interesting paper published in the British Journal of Psychiatry in September 2019.
Regardless of how you think about borderline personality disorder as a construct, we clinicians all know what it's like to sit down with someone and feel a patient's chronic emptiness, that desperate reaching for help or vigorous rejection of it. Calling this a personality disorder has always struck me as a very bad public relations maneuver for psychiatry, basically saying we, who are so normal, will call you personality disordered. But taking what for now we're stuck calling borderline personality disorder, is there a connection between maternal prenatal life stresses and later acquiring that diagnosis in the offspring? After all, borderlinity is more of an attachment thing, I had thought, than a prenatal thing. Well, here's how the authors of a new study went about the question. They used the Helsinki cohort, which was started back in 1975, when for a year, all of the children born in Helsinki were enrolled for a sample of 6,500 kids. This study focuses on 3,600 kids whose mothers had completed health and well-being questionnaires during pregnancy. And then the authors looked in the Finnish hospital discharge register for those in the cohort who, as adults, by 30 years later, had acquired a diagnosis of personality disorder during their hospitalization. Well, only 40 cohort members of that 3,600 kids were given a personality diagnosis, just over 1%. But the authors point out that they only looked at hospital discharges, so we're only capturing the more severe illness here. The assessment of maternal stress during pregnancy, that was a little indirect. A questionnaire asked about subjective stress, and the researchers lumped the women's responses into none, moderate, or severe stress. Perhaps this crude measure of assessing and quantifying stress makes the results even more impressive because they are robust. Moderate or severe stress during gestation raised the likelihood of being given a personality disorder diagnosis in the offspring by a factor of 3 compared to those unexposed to such stress. And for the severe stress group, again, that's prenatal stress, mother's subjective report thereof, a 9 times increase in the likelihood of the offspring getting a diagnosis of a personality disorder. So was it the stress or was it other confounds? And I'm sure some are coming to your mind. Maternal depression, for example, during pregnancy would be a key one. And then other confounds for which the research team controlled included moms and dads' psychiatric history per the Finnish National Population Registry. And then they basically looked at the results that survived controlling for all of these factors, including particularly maternal depression. So what is the basis of this observed association between prenatal stresses reported by mom and 30 years later, whether or not the offspring have acquired a diagnosis of personality disorder? The authors highlight a large Norwegian study that found shared genetic factors explained about a 40% of the association between prenatal depression and what they called internalizing or externalizing problems in offspring. They found a 40% association between depression in mom during pregnancy and the finding of these problems later in offspring. Notice that they're using maternal depression as the marker of prenatal stress. So it was already shown in another cohort study, the Avon longitudinal study of parents and children, the ALSPAC, that antenatal depression, prenatal depression, is significantly associated with postnatal depression. And that in turn is associated with maladaptive or nonresponsive parenting. So you can see this kind of connection through over time. that can confound the finding of just looking at prenatal maternal stress. In the study, the Finnish one, the results were independent of maternal prenatal depression. In other words, we're looking at something that operates even when mom is not experiencing depression. The authors speculate that a woman's subjective stress during pregnancy might actually be a better measure of risk to the offspring than her degree of depression. I think it's fascinating that we're looking at a prenatal stress to the child that is manifest in a population record 30 years later.
Thanks for that, Jim. Next up are the key points that summarize the study. But before that, would you do us a huge favor? If you have an interesting paper you'd like to share with us and have being discussed by Jim in the podcast, let me know. Email us at podcast@psychopharmacologyinstitute.com. Great. And now get ready for the key points. Moderate or severe stress during gestation raised the likelihood of being given a personality disorder diagnosis in the offspring by a factor of 3 compared to those unexposed to such stress. Prenatal depression is significantly associated with postnatal depression, and that in turn could be associated with maladaptive or nonresponsive parenting. Do you want to hear more from Dr. Jim Phelps? He has a regular audio updates on our platform called Quick Takes, where he discusses psychiatry research hot from the oven. Check it out on our website and visit piupdates.com and become a premium member already. We have a bunch of CMEs and essay credits for you to collect. If you're a premium or a premium plus member and you refer a friend to join our platform, you will receive a $50 Amazon gift card. You can also choose to join our newsletter to receive weekly updates delivered straight to your inbox. If you have a clinical case you'd like to share and hear it being discussed by experts on the podcast, email me your case at podcast@psychopharmacologyinstitute.com. Thank you. The following people participated in this episode: Dr. Flavio Guzman as a general editor, Andy Rode as audio engineer, Pamela Gonzalez as a project manager, and myself, Dr. Wegdan Rashad, as the host. We'd also like to thank Dr. Jim Phelps for being with us. Thank you for joining us in today's podcast. Until the next episode, goodbye.